All right, Isabel, thank you for coming in today. I hope you're comfortable on the hospital bed here. Let's go ahead and jump into your diabetic foot exam. I do want to have a pretty in-depth look at both of your feet as you are newly diagnosed with diabetes. It's important that we keep up with your foot health. So I'm going to go ahead and put a pair of gloves on just to protect the hygiene of us both. Excuse me while I just take a second to put these on. So now that I have my gloves on, we can go ahead and get started with the examination. So I'm just going to start by having an overall look at both of your feet. I have a small light here that I will be using. And I'm just going to use this to have a look at the overall skin integrity. So especially looking at the bottom, I want to make sure that the skin is intact and that there are no signs of openings or any thinning or hardening, signs of calluses and that kind of thing. So just having a look at the general health here. I'm just going to briefly lift your foot and look at your heel. Okay. Good, okay. So the overall integrity of your skin actually looks very healthy. I'm not seeing any signs of overwearing in any areas where it would indicate that maybe your shoes are the incorrect size or that they're pushing on any areas more so than others. So that is very good. It appears that your footwear is giving you adequate support. I did have a look at both of your shoes before getting started with the exam, and they appeared mostly normal. There was no indication of wasting on either side to the other, or that you're shifting your weight or using one leg more so than the other, so that's good. There was signs of normal wear within the soles of the shoe, and they don't look like they need to be replaced at this time, so that's good. So let me just go ahead and take a little note here. Skin integrity is healthy and within normal limits. Okay. No signs of excess wasting or abnormal wear. And soles were bilaterally worn. No indication of an abnormality one side or the other. Okay. Perfect. Well, let's go ahead and have a look now between the toes. So this area tends to be overlooked sometimes because we're not always able to look between the toes. Some patients have trouble reaching in between the toes. So I just want to make sure that there are maybe no signs of a fungal infection. Fungus can tend to hide in these very small, hard to reach areas. So we definitely want to make sure that we are having a very good look. Not seeing any signs of a fungal infection or any sort of dermatitis. Skin is intact and healthy, clean and dry. There's no excess signs of sweating. Just having a look at your veins that run along the side of your foot here. They are visible, normal in color and size. There's no appearance of varicose veins on either your legs or your ankles. Also not seeing any signs of discoloration in this area here, which could indicate a more severe diabetes diagnosis, but you are newly diabetic, and that's something that we maybe would see a couple years down the line, but for now, everything looks okay. A major vein that runs down the length of your foot here, and it does appear to be of normal color and size. It is palpable, and it does roll upon manipulation, which is good. We don't want to see any stiffness, so that's a very good sign. Okay. So the next thing I'd like to do is just do some manual palpations of the toes and nail beds, and this is checking for any signs of abnormal capillary refill. So I'm just going to push down gently but firmly on the tips of your toes, and looking for that normal reaction here, which I'm seeing. So essentially looking for a blood flow return of less than 1 to 2 seconds, and I am seeing that here. So now I'm going to press down on the nail, and again looking for the same thing. Perfect. Okay. So go ahead and do that on the other side. I'm going to start by pressing down the bottom of the foot. And again, I am seeing capillary refill within normal limits, less than a 1 second return, which indicates very healthy blood flow. Very good. Now the nail bed. Okay. So all of that appears to be normal. I did note a few scars on your leg here, which I have seen notated in your chart from a previous surgery. So we do have that documented, as well as these tattoos, which do appear to still have healed healthily. So that's great. I am seeing a very small calloused spot here. Looks like you may have been wearing sandals. This is a common spot where Sandals tend to rub on the foot, so that's okay. It does appear to be healing healthily. We do want to make sure that you're watching for any sort of areas like this, okay? Because we don't want to let it go for too long unnoticed. As a diabetic, over time, you can unfortunately tend to lose the sensation in your feet, which is something we will be going over today. But for now, do pay attention to these overly worn areas, okay? Skin overall is in very good shape. Normal color and texture for ethnicity and age. Soft to the touch. Hair growth appears normal. Not seeing any signs of hair loss, which is good. We don't want to see any hair loss as we come down the calf closer to the ankle area, because that could indicate, like I said, a more severe case of diabetes. But for now, I think you're okay there. So let me just go ahead and notate that. Tattoos appear to have healed normally. Capillary refill was within normal limits, +2, less than 1 second. Bilaterally. Very good, and just scrolling down. Do you want to just note that I did see the scars that were previously noted in your chart, and they still appear to be healthy. There's not an excess of scar tissue or anything that I would think we would need to have a closer look at there. Okay, so why don't we go ahead and move on. I do want to have a look at a few measurements, and this is going to help check for symmetry between the feet, okay? So I'm just going to take my measuring tape here. It might be a little cold, I apologize. I'm just going to be taking a couple measurements of your foot. So let's start with just an overall circumference here. So we're at about 8 3/4. Same here. Okay. I'm seeing a slight difference in the width of the pad of your foot on this side. So I'm getting about 9 inches at the widest part here, and just shy of about 8 3/4 on this side. So I'm just going to go ahead and note that on the left side, we have about a 1/4 inch difference. Are you right-handed? Okay, so that makes sense. Typically the dominant side is slightly bigger than the non-dominant, so that is to be expected. So let me just have a look, one foot length to the other. About 9 inches. 9 inches, so that's great. It's not an indication that you would need to buy multiple shoe sizes, which unfortunately some patients do have to do. Ankle size is right at about 9 1/4. Curious to see if we're going to see a slight difference on this side. Just barely. Okay. So overall, you are fairly symmetric. I'm seeing very slight differences on one side to the other. The larger measurements do appear to be coming from your more dominant side, so that is not something that I would consider an abnormal finding, but I will go ahead and take a note so we can keep track of your next visit. Just make sure there's not any edema that we might be missing in today's visit. Okay. All right, Isabel, so let's go ahead and move on to the next part of our test. And for this, I am going to follow up on a couple of measurements here. I have a few different devices that I will be using for this. So this is a set of calipers, and essentially they're going to allow me to, again, compare from one side to the other. So I'm mainly using this in the areas that we notated a few differences here. So let's check this side here. I want to go like the widest part of the pad of your foot. So we'll do here. And noticing that slight difference. It's nothing major, and I don't think it's any indication of like a possible bunion that could be forming here. I do think your bone structure is healthy. I'm not noticing any distension. I think that it just happens this part is slightly wider, which is okay. And then I just want to check. Very good. Okay, so overall I do appear to be seeing a larger space between these toes. It appears that this foot might be gravitating slightly inward, which is likely just a natural formation of the bone in your small toe here. It's slightly rotated more comparatively to this side here, but it's nothing that I think is like an emergency or anything that we would need to look into further. Everybody's bone structure is different, so just something to keep an eye on. We don't want to see this toe start to turn down. Okay. So next I'm going to take my arc ruler, and this is just going to measure the arch in the bottom of your foot. So using the bottom side here. I'd say we have about a 2.5 grade here, and pretty similar on this side. Okay, so definitely seeing some symmetry here, very close. Then if we switch to the other side, get about a 3. About a 3 here as well. Very good. So, okay. Very good. So let's go ahead and measure here. And very similar here. Good. So I do appear to be noting maybe a slight very slight. So again, the toes here appear to be slightly more downward compared to the other side, but I think that's just an indication of a slight abnormality in your bone density on this side compared to the other, probably related to your more dominant side. Okay. So I'd say that's about a grade 1 abnormality. So once we get to grade 4, 5 is when we start to worry about the bone structure, but for now, I think you're okay. I did mark it down. It's something that we can keep track of over time. So what I'm going to do now is take this small tool that allows me to mark certain areas of your foot, It is washable, so don't worry. It's also non-toxic. And I'm going to straighten out your foot here and flex up as far as you can. Very good. This might tickle a little bit. I'm going to draw a line straight down the bottom of your foot. Very good. Okay, and then I want you to bring your foot down. Curve, curve, curve. Good. And I'm going to mark here. And then we're going to do the same on this side. So straight up. Ticklish, I'm sorry. Very good. Now curve your foot down, down. And I'm going to mark here. And then if you'll just place your foot in a relaxed position, I'm just going to measure the difference between the two sides with my curved tool here. Good. Okay. This just allows me to check for placement. And we are about even. There is practically no difference, which is very good. Okay, perfect. So I will go ahead and put these tools away and we can move on to the next portion of the examination. You doing okay so far? Okay, perfect. So let's go ahead and move on. So I have another tool here. This is called an otoscope, and typically this is used to check different orifices of the body. So we would use it to check your ears, your nose, but it can also be used to check for a closer look at skin integrity and nail health. It's magnified, so it just allows me to look inside, and there is a light. Okay, so I'll just be shining this in your feet. You can just relax. You don't have to do anything here. I'm just gonna have a closer look. Mostly looking underneath the nail. Trying to get a look at the nail bed. Very good. Sometimes there can be small things that are a little more difficult to see, but I think we're okay. Okay. Just looking at this side. The only thing I would say is of note is it does appear at one point you had acrylic tips or false tips applied to your nail. Is that correct? Okay. The only reason I know that is because there is a slight line of demarcation where the nail tip was, and I'm able to see that here, but that's not any indication of anything abnormal. It's just the nail tip itself can leave a line just as it would on the nails on your hand. So just something that I've noted there. Okay. So moving on, I am going to be using my stethoscope to listen to the arteries in your feet, and this is going to allow me to listen for blood flow, make sure everything is flowing well. So this is going to be a little cold. I'm just going to place it on your inner ankle and just breathe normally for me. So heartbeat is normal. I am able to hear it. Strong. Very good. Okay. So just doing that on the opposite foot so that I can compare both sides. Okay. Again, heartbeat is strong. Very good. Okay. So now let's just do that on the outside of your foot here where you have a major artery. So just placing that here. Very good. Okay. And here. Very good. Now I'm going to listen to the bottom of your foot. Very good. Perfect. Okay. Okay, good. Okay. So let's go ahead and do a brief repetition of that test. This time, I'm going to lightly percuss different parts of your foot as I listen with my stethoscope. So you're just going to feel a light tapping, okay? Very good. Very good. Very good. Perfect. Okay. All of that sounded very good. Okay. So let me go ahead and remove my stethoscope, and just going to take a quick second to catch up on my notes. Okay, so blood flow is equal bilaterally. Pulsations are strong and within normal limits. No signs of flutter or lack of flow. Okay. Okay, so while I have my reflex hammer out, Isabella, I'm going to go ahead and do a few more percussions of certain areas of your foot, and this is just going to allow me to check the reflexes in your foot. So you might feel me flexing or tapping. If it does cause you any pain, just indicate that for me so that I can stop. Okay. Good. Just looking for a normal neurological response, which I am seeing. Okay. Well, so I do have a few other tools here that I will be utilizing. So I'm just going to do a variation of that same exam with a different hammer. this portion of the exam might be very slightly uncomfortable, so I do need to check your Babinski Reflex, which is testing your neurological function. So I'm going to run a cold, sharp object along the bottom of your foot just briefly, and I'm intentionally trying to elicit a response here, so just allow your foot or feet to react naturally, okay? Very good. And do that just one more time. Good, okay. Let's go ahead and test that on the opposite side. Okay, so it's not getting quite as strong of a response on this side. Very strong indication there. Does that feel any different from one side to the other? Feels the same here and here? Okay, good. Okay, so just a very slight difference in reaction from one foot to the other. I did get a slightly stronger response on your right foot. Okay. All right, Isabel, why don't we go ahead and move on to the next portion of the exam, which is a sensation test. So I have a few objects here that I will be using to test the sensory components of your feet. So let me just gather some supplies here. Okay, so starting with the easiest portion of the examination, I have just a very soft piece of gauze here. Essentially, it's a very soft piece of cotton fabric. And I'm just going to place this over my finger and use the very corner to test for sensation in your foot, okay? So this shouldn't hurt. It might tickle very slightly, but I don't see that it would cause you any discomfort. Very good. Good job. Just nod your head when you feel it. Very good. Okay, and no difference here and here. Perfect. Okay. So let's try another soft object. So I have two cotton wisps here. This time I'm going to do it on both sides, and I want you to tell me if there's any difference from one side to the other, okay? So, any difference in sensation here? Good. And here? Here? Perfect. Here? Does that feel the same? Equally on your toes. Good. And that all feels the same. And no difference here. Perfect. Okay. So the next object I have is like a scratchy sponge. And again, just nod your head when you feel it. No indication of difference in sensation here versus here. And here versus here. Feels the same. Okay. Very good. So let's try something a little different. So this is an acupressure tool, but I'm going to be using it to place pressure on different parts of your foot. I just want you to indicate if you feel it. Okay. Good. And you feel me slightly moving your toes. Very good. And you feel that here and here. And here and here. And that all feels the same, right? No difference. Good. Okay. So here. Good. And here. Very good. Okay. So let's try something quite a bit more subtle. Just have a gentle puff of air that I'll be just kind of pushing onto your toes and the bottoms of your feet, and I want you to just indicate whether or not you feel it. This one is a little more difficult. Good. You can feel that here. Okay. Very good. Any difference here? Feels the same. Okay. Good. So let's try to see if you can feel the difference between 1 point or 2. So just to give you an example, this would be 1 point and this would be 2. Good. And I just want you to indicate to me whether or not you feel 1 or 2. 1, 2. Good. 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 1. 1. 1. Good. 2. 2. 1. And 2. Very good. Okay. Good job, Isabel. We are almost done with the sensation portion of this examination. So let's go ahead and move on to probably the most prominent feeling device that I have. So this is a Wartenberg wheel, and essentially it's a very sharp wheel that I will be using to run along the bottoms of your feet, and I just want you to tell me if there's any loss of sensation as we go from your toe to your heel. Essentially what I'm testing for is any thickening of the skin. So the heel naturally is slightly thicker than other areas of your foot, especially the sole. The sole of your foot has the thinnest skin, so you'll likely feel it more here in the middle. But I want you to tell me if it feels quite a bit more sharp up here than it does at your heel, okay? So far feels the same. Good. So I'm going to do the middle of your foot, which is the most sensitive. Good. In here. Good. Let's try this side. Any difference? Feels the same. Okay. And this feels the same. Good. Good. So all of that feels the same. If I just do your heel, and your toe, same. Good. Same. Very good. Okay. Okay, so the next thing I have to test your sensation with is this brush. And I'm just going to run this along the bottom of your foot, and this is similar to the Babinski. You don't have to indicate whether or not you feel it. I'm just looking for a certain response, okay? seeing that consensual response from one side to the other. So you can see I'm touching this side, but we're getting a response here, which is exactly what we're looking for. Very good, okay. So let's do that again, but with something that has a wider surface. So we're testing the same thing, but this time it'll just touch a larger surface area. Some really healthy responses here. So it doesn't appear that your diabetes has begun to affect you in a sensory aspect. All of your neurological functions appear to be intact at this time. And this is something that we will continue to test just to make sure that there's no decline in status. And I would like to see you at minimum annually so that we can keep track of this once a year. Any longer than that and we risk missing something major. Okay. So let's try to test whether or not you can feel whether something is cold or warm. So I have a device here that is very cold. It's been kept in the freezer versus my hand, which is relatively warm, and I want you to just tell me whether or not you feel the cold or the warm. If they feel the same, do let me know. Okay. Cold, cold, warm, cold, warm, cold, cold. Cold. Good. Very good. Okay. So all of that appears to be within normal limits. Okay. So the sensation portion of this exam is complete, and you did do very well. There was no abnormalities. There's nothing that you couldn't feel. There were no signs of asymmetry in your sensory responses, meaning one side wasn't able to feel things more so than the other. Everything was equal, which is very good. So far, there's no indication of your diabetes having affected your legs or your feet. And this time I'm just going to do some temperature checks here. So I'm just applying pressure to your legs, coming down your feet, and just feeling for any changes in temperature. So we do frequently see colder extremities in diabetic patients. Mainly the toes tend to run cold. So that's something that we do want to check for. That would indicate a lack of circulation. So there are ways that we can combat that, but your toes do feel warm to the touch. They are dry, not overly moist, but temperature is even. Good. Okay. So I'm going to move these tools out of the way. And what I'm doing now is I'm just going to move slightly closer, and I'm going to hold your foot in my hand, and I want you to just relax it down. I'm just going to quickly use this tweezer device to very slightly pinch the skin, and it's just going to help me have a closer look at the overall elasticity of the bottom of your feet. Good. Okay. Let's go ahead and have a look at that on the other side. Very good. Okay. So skin integrity. Is normal. Healthy and elastic within normal limits. Okay. Well, Isabel, overall, I would say that you have a clean bill of health as far as your diabetes is concerned with your feet and legs. There were no significant abnormalities to note. There are a couple things that I did notate in your chart just so we have it on file so that when you come back next year we can retest and compare the findings. But there wasn't anything that is worrisome. I would like you to just keep a close eye on your feet. Preferably you would be wearing closed-toed shoes majority of the time. It's not a good idea to go barefoot anytime, especially if you're outside or at the beach, because there are items that you could step on that you might be unaware of. For now, the sensory components of your feet are intact, but as the years go by and diabetes tends to run its course, we can lose those sensory neurons. So I do want you to just keep that in mind. Closed-toed shoes also protect the toes, which can be the most vulnerable parts of your feet. So if you want to wear sandals, that's fine. They do have medical sole sandals made by different brands, which essentially are sandals that have a thicker sole at the bottom just to provide more protection to the bottom of your feet, which is where we tend to see diabetic ulcers. So I'm not noticing any of that at this time. I am just going to do some deeper palpations of your foot. Just kind of a last once over, checking for any abnormalities, any possible lumps that could be underneath the surface of the skin. Does any of this cause you any discomfort? Okay. And if I palpate kind of deeper here, that doesn't hurt at all. Perfect. Okay. And again, just a deeper palpation on the very middle sole of your foot. No discomfort there. Good. Just going to flex. All right, Isabel, well, I would say for today you are good to go. If you'd like, we can schedule next year's appointment before you leave. If not, you're welcome to log into your patient portal and schedule that appointment when it's convenient for you, okay? All right. Well, thank you so much for coming in. I appreciate your time. I am very happy that you're keeping track of this. And if you have any questions or you need to reach me, please just call the office, okay? Thank you so much.